Welcome to the Wellington Blood and Cancer Centre Radiation Therapy Department, where you will be receiving treatment to the head and neck area. This video will show you what to expect in your upcoming appointments. If you have any questions at the end of this video, please speak to one of our radiation therapy team. Head and neck cancers are treated in different ways depending on the type and location of the cancer. Some patients are treated with radiation alone, while others may have surgery before radiation therapy. Others have chemotherapy at the same time as radiation therapy. Please speak to your oncologist if you have any questions about your particular treatment approach.
How's the last week gone for you?
It's a lot easier in the fact that I know what's going to happen every day when I come here.
Radiation therapy works by damaging tumour cells. We are able to shape our radiation beams to accurately target the cancer while minimising damage to normal tissue. The treatment is delivered by staff called radiation therapists,
So what area would you like to treat?
who will work with our team of oncologists, nurses and other health professionals to support you through your treatment. Once you and your doctor have decided the best course of treatment for your cancer, an appointment will be made for you in the radiation therapy department.
How are you?
This appointment is for a CT scan, which will be used to plan your radiation therapy and to make a mask to hold your head in the correct position for your treatment each day. This scan is an addition to others you may have had recently. Our reception staff will need you to complete some paperwork before your appointment, so please arrive 20 minutes early to allow time for this. A radiation therapist will then explain the CT scan and mask making procedure to you. If you have any questions or concerns about the procedure, this is a good time to ask them. If you think you may have difficulties with the mask over your face, please let one of the radiation therapists know, as there are things we can do to help.
Hi Vince, nice to meet you.
And this is our student James.
Yeah, hi Vince, nice to meet you.
To prepare for the CT scan, you will need to change into a hospital gown. Please remove any jewellery on your face and neck. The CT appointment will take around 30 minutes. Firstly, a beanbag pillow will be made under your head and neck area. The second step is to create a mask. The mask is made by softening a plastic material in warm water. Once softened, the mask material will be gently stretched over your face, neck and shoulders, creating a mould of your eyes, nose and ears. Although this is an unusual sensation, you shouldn't feel any discomfort or pain. As you can see, there are many tiny holes in the mask, which allows you to breathe normally. The mask is attached to our bed frame. The mask needs 10 minutes to cool down to set. We place cold towels around your head and neck area to help speed up this process. You may feel the mask harden around your face. This is normal. Please let the staff know if you think you may have issues staying in the mask during this time. We may also create a mouth bite for your treatment. This helps keep your tongue in the same place. More information will be given if this is recommended for you. We may inject a dye just before the scan. If this has been requested for you, we will explain the procedure before we begin. We will place some marks on the mask which will be used when you're having treatment to ensure you're in the right position. When the scan begins, you will move in and out of the machine several times, and although you will hear a soft humming noise, there is no pain or discomfort. The CT scan takes a picture of your head and neck to give a 3D image of the area that needs treatment. Once the scan is complete, the mask is removed. Finally, we may make a small freckle-sized tattoo on your chest.
Just pop on that wee drop of ink.
Along with the mask, this will help the radiation therapists deliver your daily treatments quickly and accurately.
So we're all done for today. If you have no other questions, you can go on home.
The radiation therapists, your oncologist and medical physicists will then begin to create a radiation therapy plan specific to you, and this process can take up to 2 weeks. The plan will undergo a series of quality checks to ensure everything will be ready for you at the time of your first radiation appointment. During this time, it's best to arrange plans for your home, work and personal life while you undergo treatment, such as talking to your employer about time off work. It's also a good time to think about your travel arrangements to treatment every day. There is free parking at the Cancer Society on Ridderford Street for patients attending medical appointments. Please contact the Cancer Society to arrange this. Please also speak to the Cancer Society if you require volunteer drivers to bring you into the hospital for your radiation appointments. If you live far from the hospital, you may be eligible to stay at the Margaret Stewart House, located near the Radiation Therapy Department. For more information, please ask your radiation team. If you require any support financially, please talk with your radiation team, as there may be help available. When you arrive for your first radiation therapy, please check in with our receptionist. A radiation therapist will meet you in the waiting room and bring you into a clinic room to explain today's appointment. Please come prepared with any questions you may have, and bring a family member or friend to support you if you wish. You will receive several leaflets including your appointment schedule and a pamphlet explaining the side effects of treatment. Treatment is from Monday to Friday, usually excluding public holidays. Please follow your appointment times carefully, as times can change from day to day. As with your CT scan, you will lie flat and your mask will be placed over your head and neck, where it will be attached to the treatment bed. The bed will move up toward the head of the machine, and the room lights will be dimmed. The radiation therapists will move your body and bed to get you in the correct position. Once your position is confirmed, the therapists and your family member or friend will leave the room. The therapists are able to see you through cameras and speak to you on the intercom.
How you doing there, Vince?
If you need assistance, please lift your hand or call out. The therapists will start by taking images to check your position, and you may feel the bed move when this happens. This is controlled by the therapists from outside the room. When your position is checked and confirmed, treatment will start. Although you won't feel anything, you can hear and possibly see the treatment machine move around you. This footage is taken from the radiation machine as it moves around the patient. There is no pain during this procedure. Music can be played to help you relax or pass the time. Feel free to bring in your own CDs or iPod. Once the treatment is complete, the therapists will remove the mask, and if there are no other appointments for you today, you're free to go. The entire treatment will take around 20 minutes on your first day. You will start noticing side effects after your first or second week of treatment, and they will generally peak at the end of treatment. Your radiation therapists, doctors and nurses will meet with you regularly to help you manage side effects, and it's important you let us know how you're feeling each day. Some information on side effects can also be found in the Head and Neck Advice pamphlet. Side effects vary from patient to patient depending on where the treatment is directed, and can range from being mild to having a big impact on how you feel. The side effects described here may not all apply to you.
Can I have a look at the skin on your neck? Okay.
During treatment, you're likely to develop a skin reaction in the treatment area. Your skin may become pink, dry, warm, and itchy. We will recommend a moisturizer to use in the treatment area. Be gentle with your skin and avoid the sun. These are a series of pictures of a patient's skin taken through their course of treatment. Sometimes your skin will become sore and begin to peel. If this happens, we will recommend another cream for you to use and provide you with dressings. You may lose some hair, usually in patches around the bottom of your hairline at the sides and back. Please use a mild soap and wash your hair using a mild shampoo.
And say, and put your...
If radiation therapy involves your mouth and throat, you are likely to experience a change or loss in taste, difficulty swallowing, and pain. Pain may be caused by ulcers in your mouth and the lining of the mouth becoming sensitive and inflamed. Your doctor will prescribe a range of pain relief medications to help with this. Try to avoid foods that may irritate the lining of your mouth and throat, such as alcohol, spicy foods, and citrus fruit. Smoking will also irritate your mouth and throat, and we recommend you stop smoking before your treatment starts. Let the staff know if you need help to quit.
Through treatment, it's really important that you look after your mouth.
Some people experience a very dry mouth, while others have lots of thick, stringy saliva, depending on the area we are treating. It's important to look after your mouth during treatment. Brush your teeth or dentures twice daily by using a soft toothbrush. If this becomes uncomfortable, speak to your treatment team. We will recommend different mouthwashes for you to use and encourage you to carry a drink bottle to stay well hydrated. We can provide you with advice and medication to help you through this time. Fatigue may set in and build up during the course of your treatment. This is caused by many factors, including the radiation therapy itself, treatment side effects, chemotherapy, travelling to and from treatment each day, and changes in routine. Tiredness can make it hard to manage the tasks you could easily perform before treatment. Prioritise your tasks when you feel most energized. It's helpful to maintain good hydration and to take regular rest. If you're having difficulties managing at home, please let your treatment team know, as you may be eligible for home help or other practical support. It's important to maintain your weight during treatment so that the mask continues to fit well and to give your body the energy it needs to cope with treatment. You will be seen by a dietitian regularly during your treatment. The dietitian will talk about any difficulties you might be having with eating and how to maintain your weight by changing the texture and type of food you eat. If you're having difficulty maintaining your weight, the dietitian may recommend meal supplements, drinks, or feeding tube for a period of time. Our dietitian will see you frequently during the course of treatment and recovery. Changes in diet can often cause changes to bowel habit. So please, tell the treatment staff if you have any concerns about your bowels. Radiotherapy to the head and neck can also cause long-lasting side effects which are not covered here, but will be discussed with you by your oncologist and treatment team.
So after the 3 weeks of treatment, I expect you're starting to feel some of the bite from the treatment.
Yes.
Once a week, you will meet with a doctor to discuss how you're doing and to answer any questions you may have. Between these appointments, our team will help you manage side effects, provide practical help you might need, such as dressings, and coordinate other members of the team to see you as you need it. You may also meet with a speech-language therapist to discuss issues related to your speech, voice, and swallowing, and our social worker who can help you cope with the impact that cancer and treatment might be having on other aspects of your life, such as family and finances. At any time, you can ask to speak to someone from the treatment team if you have concerns. Some patients will also receive chemotherapy during their radiation therapy. This is done on level 3 of the Blood and Cancer Centre under the care of the medical oncology team. If you're having chemotherapy, there will be additional regular appointments to meet with your medical oncology doctors and nurses over the course of your radiation therapy. A community cancer nurse will also be in contact with you and will visit you at home during treatment. You have now seen an overview of what to expect when you come for treatment. Please visit the patient library in the main radiation waiting room, where you can find information booklets on cancer, treatments, and how to look after yourself both during and after treatment. The Cancer Society also has other resources that may interest you. They can provide different support groups that can help you through treatment. Please see their website for more information or drop into their rooms. If you have any questions about this video or anything about your treatment, please contact the radiation team. We are here to help you through your treatment.